Welcome back. When most people think about retirement, they picture travel, family time, or simply enjoying the freedom they've worked so hard for. What rarely comes to mind? The true cost of healthcare. And here's the surprise. It's not just about Medicare premiums or the occasional doctor visits. The biggest expenses often come from places most retirees almost never plan for. Things like prescription drugs, dental work, vision care, hearing aids, medical equipment, and especially long-term care. In fact, healthcare is one of the fastest growing costs in retirement. And if you're not prepared, it can quietly eat away at the savings you've worked decades to build. Hi, I'm Hank Persia, President and owner of Starboard Wealth Advisors. For years, I've helped high net worth retirees and pre-retirees create strategies to generate reliable income and help protect their wealth from the unexpected. And one of the most underestimated risks I see again and again is healthcare, because people assume Medicare will cover most of it. The reality is, it does not. So in today's video, I'm going to break down why healthcare costs rise faster than you might expect, the types of expenses most people forget to plan for, and practical strategies to prepare so your retirement isn't blindsided. If you find this helpful, don't forget to watch our other videos for more practical retirement strategies. And if you'd like to see how this applies to your situation, use the link in the description to book a call with me. I'd be glad to walk through your options. Let's get started. Part 1. Why healthcare costs are rising faster than inflation. One of the biggest mistakes I see in retirement planning is assuming healthcare costs will rise at the same pace as everything else. Here's the reality. Everyday expenses like groceries, gas, or travel typically increase around 2 to 3% a year. However, healthcare costs often rise at 5 to 6% per year, and sometimes more depending upon the type of care and where you live. That difference may not sound dramatic in the short term, but over a 20 to 30-year retirement, it compounds into something much larger. Let me put it in perspective. Imagine you budget $6,000 per year for healthcare at the start of retirement. If costs rise 6% annually, in 20 years, that same care could cost over $19,000 a year. That's more than triple what you started with, and that's just one line item in your budget. For high net worth retirees, this creates two challenges. Healthcare begins to take a larger share of your retirement income over time, and the unpredictability of those costs makes it harder to project how much you'll really need. And here's the kicker. Medical advances are helping people live longer, which is great, but living longer also means facing more years of rising healthcare costs. That's why it's so important not just to plan for healthcare as a fixed expense, but to build in assumptions for faster than average inflation. It's one of the hidden forces that can quietly eat away at your savings if you don't account for it. Part 2. What Medicare does and does not cover. One of the biggest assumptions I hear from retirees is once I get on Medicare, most of my healthcare expenses will be taken care of. And while Medicare is a tremendous benefit, it doesn't cover everything. And those gaps are where many retirees get caught off guard. Let's break it down. What Medicare does cover. Medicare Part A covers hospital stays, which includes things like inpatient care. Part B covers doctor visits, hospital outpatient services, and preventative services like screenings, annual physicals, and vaccinations. Part D covers prescription drugs, but with some limits. All of that sounds comprehensive, but what surprises most people is what Medicare does not cover. Dental care. Routine checkups, cleanings, fillings, and dentures are not covered. Vision. Eye exams, glasses, and contacts are generally excluded. Hearing. Hearing exams and hearing aids must be paid out of pocket. And most importantly, long-term care. Medicare only covers very limited short-term stays after a hospitalization, but does not cover in-home care, assisted living care, nor skilled or nursing home care. Even with a Part D prescription drug plan, certain medications can leave a retiree with significant out-of-pocket costs, especially for specialty drugs. Even for the services Medicare does cover, you're still responsible for deductibles, copays, and coinsurance. For example, with Medicare Part B, you generally still pay about 20% of the approved charges. That may not seem like much, but for a serious illness or ongoing treatments, those costs can add up quickly. That is why many retirees add supplemental insurance, like either a medigap policy or a Medicare Advantage plan, to help cover some of the gaps. But even those plans come with their own premiums, ever-changing provider networks, and formularies, covered drugs, and other limitations. The bottom line, Medicare provides a solid foundation, but it's not a blanket solution. And if your retirement plan doesn't account for what Medicare does not cover, you may find yourself dipping into savings more than you expected. Part 3, the big risk, long-term care. When people think of healthcare and retirement, retirement, they often picture things like doctor visits, prescription drugs, or an occasional hospital stay. But the single biggest healthcare expense most retirees face aren't routine costs, it's long-term care. And here's why it matters. According to the 2023 Administration for Community Living study, roughly 70% of people age 65 and older will need some type of long-term care in their lifetime. That care may be a few months of in-home support, or it might be years in an assisted living or skilled nursing facility. And unlike medical bills that Medicare helps with, long-term care is mostly an out-of-pocket expense. Let's talk numbers. A private room in a nursing home can easily exceed $100,000 a year in many parts of the U.S. Assisted living facilities may run between $50,000 and $70,000 per year. Even part-time in-home care at $25 to $30 an hour can add up to $40,000 to $60,000 annually if you need daily support. Think about it. If one spouse requires 3 years of nursing home care at $100,000 per year, that's a $300,000 expense. For a couple who have saved $2 to $3 million, that may not wipe them out, but it can significantly reduce the legacy they plan to leave behind or limit the surviving spouse's financial flexibility. And here's the tricky part. You don't know if you'll need it, long-term care. Some retirees may never require long-term care, but if you do, the cost can be life-changing. This uncertainty is what makes long-term care such a critical and often overlooked part of retirement planning. For high net worth retirees, the concern isn't just will I go broke, it's often will these costs eat into my wealth I bill for my spouse, my children, or charitable causes I care about. The key is to recognize that long-term care isn't just a medical issue, it's a financial planning issue, and addressing it early gives you more choices, whether that's through insurance options, hybrid strategies, or simply setting aside assets with this possibility in mind. Part 4. 4 hidden healthcare costs that sneak up on retirees. Beyond insurance premiums and long-term care, here are some other expenses that many retirees overlook. Medical travel, driving to specialists or paying for care not available locally. Second, specialized equipment, hearing aids, mobility devices, or home modifications with like ramps and walk-in showers. Third, inflation on supplemental plans. Even medigap or advantage plans can see rising premiums over time. And fourth, non-covered treatments. Some therapies, procedures, or alternative treatments aren't included in coverage. Individually, these might seem minor, but over 20 to 30 years of retirement, they can add up, plus they usually increase in costs as health needs change with age. Part 5. 5 planning strategies to help manage healthcare costs. So what can you do? Here are a few practical strategies. First, build healthcare into your retirement budget. Don't just plan for living expenses and travel. Create a dedicated line item for healthcare that grows faster than inflation. Second, consider health savings accounts, HSAs. If you're still working and eligible, HSAs can be a powerful way to save. Contributions are tax deductible, growth is tax deferred, and withdrawals for medical expenses are tax free. Third, evaluate long-term care insurance or alternatives. For some, traditional long-term care insurance can make sense. For others, hybrid policies or even self-funding strategies may be a better fit. The key is to evaluate options before you need care because costs and eligibility change with age. Fourth, tax-efficient withdrawal planning. Healthcare costs may qualify for certain tax deductions, and coordinating withdrawals from taxable, tax-deferred, and tax-free accounts can help you cover expenses more efficiently. And 5, stress test your plan. Consider working with a financial professional to model what happens if you or your spouse face significant medical expenses. The goal isn't to predict the future perfectly, it's to make sure your plan can bend without breaking. The bottom line is this: retirement healthcare costs are real, they're rising, and they often catch people off guard. But with thoughtful planning, you can prepare for them in a way that helps protect your wealth, your independence, and your well-being. If you're approaching retirement and want to make sure your income plan is built to withstand healthcare surprises, let's talk. Use the link in the description to book a complimentary consultation, and I'll walk through your options so you can select the most appropriate combination of actions for you and your family. Remember, at Starboard Wealth Advisors, your financial destination is why we're here. Thanks for watching, and if you found this helpful, make sure to watch our other videos for more clear, no fluff retirement guidance, or contact us for a simple phone or Zoom call. See you on our next video.